Hi everybody, it's Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, and today I'm going to be talking about stretches for neck pain. It's part of the research I'm doing for my second book, a second edition of my book called Neck Pain. That's on Amazon, and it was my bestseller. I wrote some subsequent books to it, but neck pain seems to be the most popular topic, and in that book I included headaches and concussions and whiplash. In this book, I think what I'd like to do is include other conditions like shoulder pain connected to the neck, and talk about stretches and exercises that people can do to help themselves. So today I'm going to cover stretches and exercises for neck pain. And if you're joining me here on YouTube Live, thank you very much, or on Instagram Live, I will record this and have it available after the recording on YouTube on our podcast called Super Healthy on Spotify, iTunes, and Google Play, and on our social media channels as well. So we're going to talk about neck pain today and the stretches that you can do for it. I'm going to give you a number of different stretches that can help you with certain conditions. So I'm going to switch over to my slide here, and my name is Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, and I practice at the Landmark 4 building, which is one of the Landmark series of buildings down on just off of Harvey, kind of the center of the city. And today I want to talk about stretches for neck pain. And these stretches will include stretches for your joints, stretches for your discs, for your nerves, your muscles, ligaments, and tendons. So I'm going to switch over to my slide right now of these stretches, and the first one I like to give my patients is this one. It's the tabletop position where you're on all fours, and then what you do is you go into an extended position with your neck up and your back sagging down. Today we're going to focus specifically on the neck. So when you tilt your neck back in this tabletop position on all fours on the floor, it helps to stretch the front part of your neck, and that's the anterior longitudinal ligament. This ligament is very important and forms the front part of the disc. So it's very important for stretching of that front part of the disc, and for you to be able to get flexibility in that area. It stretches those ligaments in the front part. It also stretches the muscles in the front part of the neck too, which really helps to increase the range of motion. Then going down into this cat pose, flexing your head forward, letting it fall down, flexes the opposite, the ligaments and muscles in the back part of the neck, which allows the discs to open up and to get more flexibility, bending your head forward. Now, these stretches work very well in conjunction with chiropractic care, because when we're doing the adjustments, we increase the range of motion and the flexibility. And then when you go home, by doing these exercises, it'll help to maintain that flexibility at home. So this is one of the more common stretches that I give patients in the clinic to help with just general flexibility of the joints and the discs in between the bones. The next group of stretches I wanted to show you are these stretches where you can do side bends. Now the side bends are good for any nerve pinching on the side, on the opposite side of the spine. So let's say somebody has a pinched nerve on the left side of their neck. I'll give them a right lateral bend for a stretch to open up the space for the nerve on the left. I'll try to avoid giving them the stretch to the left side because I don't want that to compress the nerve, cause more irritation. So really these stretches are condition specific, and that'll be a caveat for you, is make sure that you see your health professional before you start anything new, because you definitely want to make sure you're doing the right stretches for your condition. The wingspan, I like to do that one for shoulder and upper back pain that's connected to the neck. So there's nerves from the neck that go down into the shoulder blade area, down the arms to the tips of the fingers, and into the front of the chest. So I like to give the wingspan for people that have shoulder issues connected to their neck. Rotation is very good, especially when we do have a pinched nerve that's being released. We want to get more rotation in the neck. It tends to be restricted when there's some nerve compression. And forward and backward bends, number 5 right here, is very good to increase the flexibility front to back. And then number 7. I like number 7 more so for traction of the neck. So often when we take x-rays of the spine, we'll see the neck losing its curvature, more of a forward lean to the head, or anterior type of head carriage, forward head carriage. And to help us at home, I often give patients either a traction device or a block to use at home, or they could use something like this too, which is a foam roller in the upper part of the back, and then just extending their head over that foam roller to get some traction in the front part of the spine to recreate the cervical curvature, that curve in the neck. So this is a very good exercise. Once we get into care, and the pain's reducing, the flexibility is coming back, that's generally when I'll give this type of stretch. These stretches right here are pretty basic. They're general stretches that most people can do. The only caveat on that is not to do these stretches in a direction where you do have a pinched nerve. So for the side bend, if you had a pinched nerve on the right, we wouldn't want to do this, but going to the left would be fine, and actually most of the time it's productive. And same thing with rotation. You don't want to rotate to the right because it can pinch the nerve further. You want to rotate the opposite direction, take the pressure off the nerve. Generally, bending your head forward is good. Backwards, I caution my patients not to bend their head backwards sometimes, because it can put extra pressure on the nerves and the joints. It does load the joints more. So we don't want to overload them, especially early on in care when patients have a lot of pain or discomfort. The upper trap stretch can be very helpful as a general stretch, and the levator scapula stretch is more of a specific stretch that I will give my patients, but not for all conditions. So for that one, if we've had some type of whiplash type of injury, or we've had some sprain or strain due to sports, then what I'll do is give something like this just to help out with flexibility of the head forward and backward as the muscle tension starts to release in the neck. There's one more slide I had for you, and that's this group of stretches right here. What I like about these is it involves more complicated movements, like the wingspan where you're sitting and then extending your arms outward, opening up the chest area. I like that because often there's a tight chest, especially if the head's forward and there's poor posture. So opening up the chest area with the wingspan is very good. Doing neck rolls generally helps with flexibility, and especially with circulation in the joints and with the discs. There's the thoracic extension we just talked about. The open book, just lying on your side like this and just allowing your body to kind of rest with your head supported, that can be very good for just relaxing the neck and the shoulders. Doing some neck retractions, or basically pulling your chin down and in, that's very good to traction the upper part of the neck or the cervical part of your spine, C1 and C2. Sorry guys, I just knocked the mic there. And then shoulder shrugs are great for the traps and the bigger muscles in the neck area. And then this kneeling arm circle can be very good too. And that's for extending the arm back, stretching the front part of the shoulder region, and these scalenes and sternocleidomastoid, the SCM, going into the neck and the head. So there's a variety of different stretches I like to give in the clinic. They're very specific for the individual and their condition. Also, the timing of these stretches are very important. So giving these stretches at the right time is very critical, because what can happen is if the stretches are given at the wrong time, then it can be counterproductive. So I find making sure that the stretches are given at the right time in care and then following up with more advanced stretches and altering the patient's stretching routine is very important. So I encourage you to find a qualified health professional in your area that can help you with stretches. If you're in Kelowna, we are accepting new patients. I'd be happy to help you. You can click the link in the bio if you're on social media, or click the link below to schedule an appointment online, or you can DM me or call the number that I'll leave in the show notes. Thanks for joining me today. Please join me on a daily basis as we go over neck pain for the next 2 to 3 weeks and different stretches and exercises that I'll be including in my second edition of the book called Neck Pain, which is on Amazon and Kindle and Audible. So you can get it in all 3 formats.